Hello everybody, we are on Instagram live. So we're just waiting for everybody to join in. Okay. Oops. Hello everyone. All right, I'm not seeing anybody, just waiting everybody to join in. Hello, I can see someone joining in now. Hello everybody. So we're just waiting, everyone starting to join in. So my name is Catherine and I'm the fertility dietitian who based in Brisbane, Australia. So today we're going to do an Instagram live on chatting about a really interesting topics. We're going to chat about male fertility issue and also answer some of your questions about how to improve sperm health. So we're just waiting more and more people to join in. Like I say, if you're watching us live, please send us a message, drop us a message here and say hello. We have a really very special guest for today and we have lots of really great questions our audience has sent in. So we're gonna dive into one by one each of your questions about male fertility issue. All right, so as I mentioned, today we have a very special guest. His name is Dr. Stephen Elgey. He is an obstetrician and fertility specialist, and he's very passionate about helping couples fulfill their dream of parenthood. He was previously the director of obstetric and gynaecology at Redlands Hospital, and he's also one of the leading fertility specialists with City Fertility. Currently consulting to two consulting clinic, one at Robina Gold Coast and also another one at Sunnybank in Brisbane. So he will be joining us shortly to have a chat with you guys here today to talk about male fertility issue and also what are the steps, the practical tips that we're going to share with you to help you or your partner to really improve their sperm health. All right, without any further ado, we are going to bring on Dr. Stephen now. So let me just see how we can. Okay. All right, we're just waiting Dr. Elgey to join us live. Okay, Elgey is on now. Hello.
Hello. Hi, Catherine. How are you? Hello to all people watching today.
I'm very good. Thank you, Dr. Steve. I'm so excited to see you here.
Thank you so much. You're looking well as well. We're all very excited to be here.
Yeah, trust me, I'm excited all week about our Instagram live.
Thank you. Thank you.
All right. So we're just waiting for more people to join here.
Sure.
But like I say, today our main topic, we're going to chat about male infertility issue and some practical tips to share with everyone here today. How we can, help their partner, or if you're listening right now, if you're a man listening right now, our Instagram right now, we are also going to share with you some practical tips on how you can boost your sperm health. All right. Now, Dr. Elgey, a big congratulations to you. I heard that you got a new clinic set up in Gold Coast. Is that right?
Yes, we have. We're down here at the Gold Coast. We have lovely room right outside City Fertility Centre.
Beautiful.
So easy to access, and we're here every day of the week.
Beautiful. Yeah. And I heard that you also you are studying right now in Master of Reproductive Health, and you've got a special interest in the topic that we're going to chat about today, which is male fertility.
Absolutely.
Yeah, can you share with us a little bit more about, what makes you so interested about male fertility?
Well, male fertility, I think, is traditionally overlooked as a cause of infertility. I find that we tend to focus on the woman, but there's very little focus put on the men. And they're often dragged here by their partner. And I think it's time that we actually do look at the male fertility, as in up to half of the couples who I see, there's often a problem with the male that is contributing or the sole cause of fertility. Infertility is not a woman's problem. It's also is a men's problem, and it is overlooked and ignored.
Yeah, so true. And one of our key messages here today is we really want to raise that awareness about male fertility issue. I guess how common it is, like in your practice, in your experience, like with the couples that you're seeing.
Yeah. So about 15% of couples will have trouble conceiving after 1 year, and that's how we typically would define as a problem in conceiving. Of that, there's about 30% of the time it's due to the male alone, and half of the time the male is contributing. So it's really a 50-50 mix. It's I say it's not just the woman's problem, it's also the men, and they are a couple. So it's quite common when I see it.
Now, for people who just join us live, now feel free to send us questions as well. We'll make sure that we answer them, throughout our live show. We're going to be here for about 20 minutes or up to about 30 minutes. So feel free to ask lots of questions here. Now, before our Instagram live as well, we have also received so many great questions, Dr. Elgey. So we're going to dive in one by one. Now, like you mentioned, Dr. Elgey, is that one of the things that when we talk about infertility, there's a lot of pressure or spotlight on women herself, right?
Yes.
So with men, is there a biological clock for men, or should I say, does age also affect men's fertility?
Yes, it certainly does, Catherine. That's a fantastic question, because you hear all these stories of older men having children, and it's not that straightforward. Over the age of 40, a male's fertility is reduced by 30% compared to when they are 30. So it does decline with age. But not only that, as men get older, because the sperm are continuously being made, the sperm can accumulate errors. So there are certain it's diseases which increase with age and is related to the sperm. A good example would be older men are more likely to have children born with what's known as achondroplasia. And that is what most people would know that as a typical form of dwarfism. That increases with the age of the male, as does issues such as autism and other conditions. So there is a biological clock for men, because their fertility does reduce and it does accumulate problems.
So at what point would you suggest for men, so say for example, a couple struggling to get pregnant after 6 months of trying naturally, at what point would you suggest men to go in for a further proper fertility assessment?
Look, I would probably recommend that men get a sperm test even before they come to see me as a couple, because it's a very easy thing to do. Investigating a woman for infertility can be uncomfortable. It often involves invasive testing. And a sperm test is not really that hard to do for the men. It's very simple. It's more fun than giving blood, is what I like to say to them.
We actually got some questions from one of the viewers here. Just how accurate, I suppose, looking at that sperm parameter test. Is it reliable, the sperm test that you just mentioned?
Okay, yes.
Is there any factors that would affect certain time, the sperm collectors, or how accurate it is?
So the important thing to realize about a sperm test is just looking at it down a microscope, okay? We're not actually assessing the ability of the sperm to fertilize an egg, or is it working properly. All we can do is count the sperm, look at how they move, and are they normally shaped. So it's a bulk test that gives us some information of a problem, but it's not a test that once you pass it, there is no problem. That doesn't mean that. So it's a very, it just looks at the overall numbers, but it doesn't assess sperm function.
Oh, that's such a good point. And talking about that, in terms of sperm function or sperm health, are there any common cause, say, for example, nutrition, lifestyle, or environmental factors can affect sperm health?
Absolutely. Environmental factors can have a huge influence, as well as lifestyle. So it's well known that men who are overweight can have reduced sperm counts. There's a whole system there going on with the hormone imbalances. Men who work with, say, pesticides or chemicals can have trouble with sperm production, and even simple things such as it's radiation from mobile phones kept close to the testes, or even laptops sitting in their groin can be a problem. Smoking is a huge issue. These can all lead to issues such as poor sperm production, or something else called it's fragmentation of the sperm DNA, which kind of chops up with the DNA, which can make it harder to have a successful pregnancy.
And say, for example, if someone thinking about, okay, we often heard about for the ladies to optimize the egg health, it takes about 3 months. What about for men? When should they start thinking about, okay, I need to take action?
Yep. So for sperm to be produced, it takes around 3 months to see any meaningful change in the parameters from lifestyle changes. That's how long it takes for sperm to be made. It's different for eggs. A woman's born with all the eggs she'll ever have. And there are some things you can do to help improve egg quality. But for sperm, it really is dependent. And a good example is that if a man has been unwell in the past 3 to 6 months, that can really knock out sperm production for quite a while. And that can recover.
Okay, that's good to know. In your study or in your research, in terms of nutrition itself, is there any kind of key nutrient that you would advise for men to really, watch out for, optimize the nutrition?
Certainly is. And I think this is where even the men, it's been willing to see a dietitian be really useful, because as you know, there are certain food groups which are high in vitamins and antioxidants essential for sperm production, such as vitamin C, vitamin E, zinc, and selenium. So a diet high in those, it can be really useful for men who are having trouble. There are supplements which they can take, but you need to be careful with some of them though. You don't want to go, as in all things in life, all in moderation. Don't go overboard on some, because that can also cause more damage.
Yeah, absolutely. That's why I think one of my key roles working with your patient, Dr. Elgey, is really that personalized nutrition assessment and care. So everyone may have a different supplement regime or nutrition advice. Yeah, absolutely, 100%. Definitely, I guess for men, we want to focus on just a good quality diet with very high amount of natural antioxidant, but also supporting through the supplementation. Now, just remind everyone. And just remind everybody here, please send through your question here. Dr. Elgey will be very happy to answer them all during our live. Now, my next question for you, Dr. Elgey, is how do weight affect sperm health? Like, do you came across any study specifically for men?
So with men's weight, it
or BMI,
really does have an impact, just like how it does with women. A man's weight can lead to various changes in sperm production, and it's never usually a good thing. The changes in such as food, which is high in oxidative stress. As men get more obese, they actually make more of the hormone estrogen. And estrogen acts as a switch to turn off sperm production. It's a regulator. So the fatty tissue converts testosterone to estrogen, and that's some of the common thing which might be described as man boobs, right, from higher estrogen levels. So weight does affect, and some men who are overweight all their life can be permanently infertile.
So certainly, I think, again, we just bring up such an important point that it's not just women have to, try to change everything, get it right. Partner as well have to do this together.
And that's the point I'm trying to make with my patients as well. It's not her problem. It's also your problem. You're involved in this. And so many times it is the male issue. And a lot of men don't want to hear that. Understandably, it's very upsetting to them to know that there's a problem. It affects their view of themselves as a man. But women, they deal with this too. So it's sharing the burden. It's sharing the load. That it's everyone's problem. And everyone needs to be healthy and fit. There's studies that show that couples who exercise together have better rates of pregnancy than those who don't.
That's good. Which bring out again the point that lifestyle changes, nutrition, environmental factors is so important in this journey. of
exactly.
trying to
If
get
your body's
pregnant.
healthy, it's going to improve everything. I guess it's one of those things where if you're unhealthy and your body might say, well, probably not a good time to be having children because you're not healthy, maybe that is a risk to pregnancy.
Yeah. And Dr. Elgey, we got a little bit specific questions here. We got one viewer saying in sharing that so basically the husband has tried to change, everything with diet and lifestyle to prepare IVF. Husband already lost a little bit of weight, has been, taking some prenatal supplement as well. His sperm analysis, it's all normal. However, DNA fragmentation, it's tested a lot higher. She was wondering what could be the cause and also what can be the treatment options in this case.
Okay, so DNA fragmentation is a sign that the environment in the testes is not optimal. It can be due to diseases or conditions, so it's really important that your partner sees a doctor who specializes in male areas, because he may have problems such as there's a condition known as varicocele, which is swollen veins in the testes. That can increase the amount of toxins and decrease with the blood flow in the testes, and that can cause fragmentation. As I mentioned before, antioxidants such as vitamin C, vitamin E, zinc, and selenium can help, but also too much vitamin C is a bad thing. Too much vitamin C actually can cause more DNA damage to the sperm, so it can be a fine balance. There is a creation of sperm does require a certain amount of oxidation. So things like hydrogen its peroxide needs to be there. If you oversupply antioxidants, that can actually cause more harm as well. So again, it's about getting the right balance. He may need his vitamin C levels checked, and just to make sure that there's nothing structural going on that could be a cause. A lot of this damage happens in a specialized compartment called the epididymis, where the sperm matures, and if it had any infections or damage there, that can cause fragmentation as well.
Wow. Can I ask as well, with couples going through, like, say, preparing for IVF, is it a routine test that, male, recommended to do the DNA fermentation test? Or it
this
depends
is a controversial topic. I've had discussions here with my embryologist and the andrology with the scientists here about that. And the trouble with the DNA fragmentation test is it's expensive. It's around about $500, and there's no Medicare rebate. So when you're advising a couple first up, let's do a DNA fragmentation, you tell them the cost. Understandably, there's going to be a bit of a, well, do we really need to do this? And often we don't, unless there's a history to suggest a problem. So that's a bit of a tricky area. There are some specialists who routinely do it. There are some who don't do it unless there's history. And again, it comes down to where is their money best being spent.
Okay, makes sense. Just in regards to these topics, another really great question here is somebody sending is their embryos tested euploid following the PGTA testing. Again, was tested very high DNA fermentation. She was just wondering, does it really affect the IVF outcome at all?
Well, just to clarify to your listeners, PGTA for aneuploidy is screening for things like Down syndrome before you put the embryo in. So commonly with DNA fragmentation, what you might see is loss of the embryo before the biopsy. So it's got to day 5, it's been biopsied, that's a very good sign, but there can be a higher rate of early miscarriage. But I think if they've got to the biopsy and all's doing well, I think that is a really good sign for them that they should have no issues. That's good to know.
All right, then. Now, some questions in regards to, I guess, more on the lifestyle questions. Can frequent UTI for men affect sperm health?
If it's just a urinary tract infection, often no. But if the UTI is actually symptoms of disease somewhere else in the male system, such as in the seminal vesicles or testicles or the prostate, then that could certainly affect male health. So it'd be important to know, is this a UTI for sure? And what's causing it? Is it coming from somewhere else? Is that what's causing the UTI? Is it spreading from one place to another? So yes, it possibly could be a cause, but a UTI by itself, no.
And another question here is, is there anything we can do for sperm morphology less than about 4%?
I think the lifestyle factors are important things to correct first. I would also want to just check on the, such as his hormone profiles, because the amount of testosterone in his system is critical. So the hormone testosterone is really important in final sperm maturation. So low morphology could be a result of low testosterone in the testicles. Unfortunately, testosterone supplements make things worse. It doesn't work that way. So sometimes to increase testosterone to help with morphology, I actually put men on medications that we might give to women to increase eggs, such as a drug called Clomid can help some men improve their sperm morphology. And that leads to an increase in testosterone, which helps sperm morphology sometimes.
Okay. All right. Certainly there's lots of, things we need to consider, isn't it? It's not like one straightforward.
Exactly. It's a very complicated area, and it's not straightforward, but it has been overlooked for far too long. I think often the easy option is, there's a problem, just do IVF. And if that doesn't work, we'll just directly inject the sperm. And look, many couples, many couples have tried for a long time to get pregnant. And the thought of, hey, let's try this for 3 to 6 months and see what happens, with no guarantee it's going to improve. Many couples just say, look, I just want to get pregnant, and they'll do IVF, because that delay to them is a long time if they can get pregnant sooner.
Yeah. And I guess that, is there any strategies you motivate the couple to make some changes? I know it's not always easy in terms of what they eat, how they live. Is there any strategies that you find it quite helpful?
That's a difficult one, because, as I mentioned, people are very impatient, and I can understand that. Sometimes I will set goals. I say, look, this is what I'd like to see in terms of weight or BMI. As you get closer to that goal, we can certainly start having more discussions and more treatments. And I set realistic targets. Okay, there's no point saying to someone, you need to lose 50 kilos before I'm going to do anything, because that's so demotivating. Because I say I can't possibly achieve that, so I'll set them. We'll negotiate. It's a target which is realistic and achievable, and also safe. And then once they get closer to that target, we'll start treatment. That's often a good. It can be a good motivation, as well as talking about the risks and complications. Good
suggestions there. A few more questions about lifestyle as well. Are there any medication men should take note of that can affect sperm health?
So medications that might affect, which they should not take.
There
are many medications that can affect sperm health. Men who are taking medications to help with baldness, such as Propecia, a drug called finasteride, that can affect testosterone levels. Some blood pressure medications can affect testosterone. Some anti-reflux medications, such as cimetidine, it's an older drug that can affect their supply of sperm and damage sperm as well. So there are many medications. So when I see my men, I give them a comprehensive questionnaire to review now what medications they're on, and just check that there are no interactions or possible things affecting the sperm production.
Okay. Good. We got, I think, a few more here. Does using lubricant can affect sperm health?
Some of them
quality.
It doesn't affect sperm health, but it may interfere with the sperm swimming through the reproductive tract by acting as a barrier. So minimal use of lubricants and water-based lubricants only if needed. But certainly you need to not use too much.
Okay. All right, then. I guess now, just everybody watching us here right now, if you have any questions, please type in your question down the comment box, and we'll make sure that we answer those as well. Now, let me just feel more about nutrition related. So you have mentioned about some of the key nutrients that you mentioned earlier on, but was there any specific, supplements or antioxidant that you would like to say, like, the men start taking to boost their sperm quality?
Look, I guess the most researched one is Menavit to help improve sperm quality. And they do have some studies showing an improvement in pregnancy rate. But generally the ones I would stick to is the ones I've mentioned before: vitamin C, vitamin E, zinc, and selenium. They could try coenzyme Q10 as well, and that may be useful. But in terms of specifics, it's very broad because there's so many different supplements out there. And if they do need more specific advice, that's when I'd be referring to someone like yourself to give them a good talk about what is available, because your depth of knowledge is much broader than mine in this area.
Oh, thank you. Thanks for that, Elgey. Yes, I think one point to point out that, 100% agree, because that, there's a really good systematic review suggests that depending on the sperm parameter, there's actually different nutrient that we can focus on.
Yeah.
That's how we prescribe or suggest men to take their supplement differently. So everybody will have a different regime depending on what's the main issue that they suffer from. All right. Actually, my final question here, Dr. Elgey, is for me, how do you think the role of dietitians can better support male fertility or better support your patients?
Absolutely. I think optimizing nutrition is important for so many women, even if they are in the healthy weight range, because there's so many factors that can affect fertility, as you know, what they're eating, what they're doing, exercise. And it's often more important as they get overweight, because I remember a talk you gave where you said as BMI goes over 30, there is a reduction in pregnancy rates. So I think it's one of the things I discuss with nearly all patients and offer a referral to a dietitian. And certainly if they've got long-term problems with diet, nutrition or weight, then they can also see their GP for a referral on a chronic disease management plan that can often help them in meeting those costs as well, and a more coordinated approach. But certainly I think most people would benefit from a referral, because let's be honest, our lifestyles these days are a little bit sedentary and diet's not always the best, is it?
Yeah, 100%. Yeah, that's why I love, working with you and your team as well, and also your patients, to really kind of give them a chance of, let's just say, at least roughly about 3 months period, just to kind of try something a little bit more natural, improving their food, their, lifestyle, and exercise, perhaps, just to help them to increase that fertility chance a little bit more as well.
A holistic approach is always useful. Just getting them there sometimes is hard.
All right, then. So, Dr. Elgey, now we are going to finish off this live very quickly. We're going to have a little fun, so I'm going to finish off with a quick round of rapid fire questions, if you don't mind.
Sure, absolutely. Fire away.
All right, let's get started. So, what is the best present you ever received?
Best present?
Yes, you ever received?
Well, I got these things on chromosome structure, which I use in my education. That's a really good present, which I use daily with my patients. So that was a gift from a patient of mine who had an interest in genetics.
Yeah, love that. And name a song you will play when you deliver a baby.
Sorry, Catherine, I missed that one.
Name a song you will play or you would love to play. When you deliver in the living room.
Salt and Pepper, Push It.
Oh, that one too. What? Okay, what dish do you cook best?
I probably cook best. I'm really good cooking Thai dishes. I'm really good at doing that. Yes, Thai I can do really well. Yep.
All right. I hope I have a chance to try your dish one day.
Yes, absolutely.
All right. What's your favorite Netflix show right now?
What's my favorite? Sorry.
Netflix. Do you watch Netflix?
Oh, I think I've just been watching the Jack Reacher series. Actually, was that Netflix? Probably is. Jack Reacher. Books by Lee Child.
Okay. And name a person who inspired you to become a doctor.
A person?
Yeah.
Yeah. Very easy. This is a obstetrician, ultrasound specialist, Dr. Frank Carmody. Before I was a doctor, I used to work as a scientist in a genetics laboratory, hence.
Okay.
And it was my job to diagnose things like Down syndrome. So women used to have to do amniocentesis to look at them back in the day. And Frank would come in, occasionally because he was the person who would see the women and take the samples for me to test. And I said, I want to do what he does. So I then went and studied medicine and became an obstetrician gynaecologist. Is it what inspired you to become a fertility specialist? Like, wow, such a beautiful story there. That's why I became an obstetrician, but fertility specialist was more based on some of my own lived experiences and trying to have children as well. So like, I'd like to help with other people have their children. Beautiful story. Now, have you ever appeared on a TV show before? No, this is my first time. Although when I was 7, I was in the background of a wombat show years ago as a child, but nothing since then. It's been a long time. And what is your nervous about today? Oh, really? It seems to be very nervous. And what is your hidden talent? What was my what, sorry? Your hidden talent. Any special talent? Ooh, I'm good at making beer. I shouldn't say that too loud. So, my special talent. Good. Oh, couldn't know that. Yeah. Making Thai, that's my sort of time out. That's my stress. I go downstairs and muck around and make things. And when friends come over, I've got stuff for them to drink. So perfect matches in it, beer and Thai food. But no, don't do it as often from dietitian. Yeah, it can be a dangerous combination. All of the coconut cream and trans fats. Bad news. Yeah. That's right. You're on a dietitian live, Dr. Elgey. I know. Well, as we say, everything in moderation, right? That's right. All right. And if you would write a book, what would that be? Oh, I'm not sure about that one. I don't know. I really don't know. Anything? Okay. That's all right. Sure. And would you rather go for a movie or a sport event? Probably a movie for me. I like watching movies. I'm a bit of a movie buff. Yeah. Okay. What is the kind? I do like go on. Events with my son. Loves sport, and I do like going to sports events with him. He's a bit of a sports buff too. So, if my son was involved, I'd go watch sports. Yeah. And what is the kindest thing you have ever done for someone else? Oh, there's so many. I think there's times that I'll go and help people for free who need their help, or friends who need my support. I'll always be there to help support them through tricky issues. Yeah. Last question here. What is the favorite part of your job? I think my favorite part is seeing people finally become pregnant and have their baby after so long and trying. It's such a good sense of satisfaction to see that come through. I really get a lot of joy from that. Yeah, absolutely. It's such an amazing journey, isn't it, to be part of someone else's life, to try to make that happen to them. That's all my fire rapid question, Dr. Elgey. Thank you so much. Thank you again for being here. It's such a great conversation with everyone here to try to raise the awareness of male fertility. And I love that you already shared so much with our audience here, lots of practical and useful tips. Now, Dr. Elgey, can you tell everyone here, where can they find you and how can they book an appointment with you? Okay, so I've got down here at Robina at the Gold Coast. I'm also at Sunnybank near the hospital. And they can just call us or go by our Instagram page. So our number is 56677711, or they can go via our Instagram or Facebook page to find us. Or also via the webpage, www.avafertility.com.au. There you go. And I'll attach all the details down our video below as well. And once again, thank you everybody for joining me today. If you find this video useful, don't forget to share our video. And I'll see everyone again pretty soon at the same time and the same place. Bye, everyone. Have a good day. And thanks, Dr. Elgey. Bye. You're welcome. Lovely talking to you. All right. See ya. Have a good day, everybody. Bye.